Guys, this is Dan, and we're continuing with our correcting low back pain, knee pain, hip pain dysfunction home exercise program. So I mentioned in that introduction when we did our assessment on ourselves, I spoke about our knees can bow in, they can bow out. Now we looked at what you need to do if you did your assessment and your knees bow inward, okay, with your heel rise as well. So you do that heel rise, knees are still bowing in. So that's one thing. We looked at those. We looked about releasing the hip flexors. But what about if we get knees bow out? So if we get knees bow out, we have to go a slightly different route with things. I'm not going to worry so much about my hip flexors. I'm going to go after another group of muscles. I'm going to go after the muscles that kind of round the back of my hip. Now I'm not releasing my glutes. My glutes get underactive. They get lengthened. Kind of in this position, this knees bow out position, they're actually in a shortened position, but they're still underactive. We've got other muscles taking on the role of the glutes, trying to do its job, but they don't do a very good job at doing it. So the glutes extend the hip. They're very, they when we do movements like squatting and running and or jumping and climbing stairs, we really need our glutes to do most of the work, but they tend to shut down if we get knees bow out. So again, if we look at that, you guys did that overhead squat and you notice this happens, so you can see that my patellas, my kneecaps aren't in line with my second and third toe anymore. So you're coming down, you kind of got this going on, and these are kind of separating. That's our knees bow out. So what we need to do is go after the muscles that work with the glutes, that are kind of taken over their role. And what we're going to start off with is doing a muscle called our piriformis, and it actually sits underneath. It sits deep to our glutes. So it looks like we're releasing with glutes, but we're not. We're actually going for piriformis. So again, this is only do this if you do have that knees bow out. So what we're going to do, we're going to take our foam roll. We're going to place it on our backside. And what I'm going to do to put my piriformis in a lengthened position, I'm going to keep my right leg bent. So I'm going to do my left side. I'll keep my right leg bent. I'm going to place my left ankle on my left knee. Now that's going to lengthen out and stretch out that piriformis. It's going to be easier for me to pin down because I've got to get through all that glute max mass. Glute max is a big, thick, deep muscle, so I need to be able to, if I stretch out the glute max as well, I can kind of get down into that piriformis a lot easier. So what I'm going to do is, once I'm in this position, I'm going to search on the upper half of my backside, where my glutes are, and I'm going to start just on my tailbone, my sacrum. And I'm going to start there. So that's where the piriformis originates from. And it goes around, it inserts round onto the side of our femur. That big, you'll feel like this big bony bump on the outside of your femur, on the outside of your thigh. That's your greater trochanter. So that's where that piriformis goes into. So I'm going to start on that sacrum, and I'm going to lean over towards that greater trochanter, and about halfway, so you should feel a trigger point just off the sacrum, or about kind of halfway between that sacrum and that insertion point on the femur. So if I kind of lean about halfway, and I run into a big trigger point right there. So I've got one right there. So again, same with our other release protocols that we did. We're just going to find that most tender spot. We're going to get it to a point of, mild discomfort, something that's manageable. So it's not excruciating. We can manage the discomfort fine. And we're going to hold it there for 30 seconds to 2 minutes until we get that release. Okay, so typically takes at least 30 seconds, so somewhere between 30 seconds and 2 minutes. You might find it takes a little bit quicker, so great. So we're just going to hold it there. We're going to wait there still until that starts to calm down. You feel like a release sensation has occurred. So you'll feel that intensity of that trigger point, or that feeling of tension is starting to dissipate and go away. And I can actually feel that now, starting to calm down and relax. Okay. So that's for our piriformis. So if you have those knees bow out, okay, this is definitely one that we're going to want to do. Okay. So that's for piriformis. Thanks for watching. We're going to do the bicep femoris, and we're going to do the adductor magnus, so there are other muscles that also help out the glutes as well. and definitely a sign that they could be overactive if we have that knees bow out. So that's what we're going to get after next. Hi guys, so we're now going to look at releasing the bicep femoris, that's our hamstring, and also our adductor magnus. So we did the piriformis. So these are mainly for if we have knees bow out. Okay, you're going to do these techniques. Okay, these three. You may, if you have knees bow in and that anterior pelvic tilt, I would just do the. You could do the adductor magnus, so you could just release it. That's fine. That's absolutely fine. I would definitely do the bicep femoris, because in that anterior pelvic position, where we've got that pelvis is dropped forward, we've got that increased lumbar curve. It's going to pull our hamstrings long, but they're going to take over the role of the glutes. Okay, so they're going to become dominant. The glutes have shut down. The hamstrings are going to take on the load. So I would definitely do the release for that anyway. So if you have knees bow in or bow out, do hamstring release. If you've got knees bow out, definitely do the piriformis and the adductor magnus, which I'm going to show you now. Okay, so we're going to start with the hamstrings. Start with the bicep femoris release. Okay, and what you guys are going to do, all right, so for our hamstring release, you're going to use these balls. Okay, you're going to need to be in a seated position. So I've just got like a little makeup stool. This is a home program, guys. This isn't this is mainly for home use, so we've got to be a little bit, got to use a bit of ingenuity here with what we can use. But you can use a kitchen stool, anything really where you're in a knee, where your knees are in a bent position. This doesn't really work so well on foam rollers, though you could try it. I just find it just this. If we're on foam roller, we're going to have our legs extended. That can put a bit more tension through the hamstrings. It's harder for it to shut down. Whereas in this position, it's a lot easier because they're on slack and they've calmed down. So you're going to need to use a ball for this. So you can use a tennis ball if you want, or these massage balls I've got here. Any kind of round surface will do. And I'm going to use this larger ball so you guys can see. And what I'm going to do to help find where we're going, if you place your fingers just behind your knee, just at the back of your thigh, right by your knee, you should feel like a big, thick, wiry, cable-like structure. That's actually your bicep femoris tendon. Okay, all right, so not the one further up here on the side, that's your iliotibial band, but you'll feel like a divot, and then you've got this big, thick tendon. Again, if you kind of push your heel back in, if I push my heel back into that stand, into that leg chair, I can actually feel that tense up. So that's my bicep femoris tendon, my hamstring tendon. And I'm going to trace that up. Okay, try and keep a feel of it till I get about halfway up my thigh. And that's roughly where the trigger point is. And I'm going to put that ball under that portion of my thigh. Okay, now you might need to wiggle around. You might need to move the ball up and down a little bit to find it. Can be a little bit tricky sometimes, but normally that's where the trigger points tend to reside. And I might need to just move my leg inward and outward just to strum that muscle. And again, I can feel a tender spot just right there. Okay, again, my leg is just relaxing. It's not doing anything. Remember to keep yourself relaxed and calm down. Big deep breaths, big breath and breathe out if you need to. Okay, and again, I'm just going to that, just finding a point that's mildly discomfort. It's got mild discomfort, it's mildly uncomfortable. I'm just going to wait there. I'm going to hold it. Should take 30 seconds to 2 minutes for that to calm down, and then I can then move on to the next technique. So I'm about halfway up the fire, ladies and gents. I'm not anywhere else. I don't want it right up here. It's about halfway up the length of the back of the fire. I'm on the outside of that kind of outside portion of the back of the thigh as well. So again, find that tendon if you can. Try and trace it up about halfway, and then you're just going to hold it there. Okay, so that's for the hamstring release. That's what you're going to do, or the bicep femoris, the actual name of it. If I want to do the adductors, so I said about one of your adductors in particular acts like a fourth hamstring. And again, if we've got that knees bow out position on that overhead squat, this is definitely one you're going to want to get into as well. So again, this with the hamstrings and the piriformis will all kind of take on the role of the glutes, because the glutes shut off if we've got that knees bow out. So these all will take over. So you're going to get your ball again. I'm going to show you this one first of all. It might be a little bit tricky to see. This can be a bit of a tricky one to find. But what I want you guys to do is try and find your sitting bones. So you might need to put your hand underneath your backside, find that sitting bone, okay? And now the muscle kind of attaches just below and just to the inside of that. So it's right in your groin. You're going to put the ball just in that area. And you might need to slide around and wiggle a little bit, move back and forth, just kind of explore that area. And again, I've got a point right there. What you can also do to kind of help pin that muscle down is just kind of lean forward at your hip slightly, just lean forward. That will lengthen that muscle out, helps to pin it down. So maybe that's what you try. So I'm just below that sitting bone muscle, just to the inside of it. That's roughly where I want to be. You might find that the smaller ball or a tennis ball is easier than these larger ones. And again, I'm just going to hold it there like I did with the hamstring and all the others releases. I'm just going to hold it, wait for it to calm down, wait for it to go away. Again, I can feel that starting to calm down now. Again, if you need to rest your legs somewhere, that's fine. I'm going to hold it still. And again, I can feel that discomfort starting to dissipate. And then we can move on, okay?